kind of think about in your head. Fever, always, okay? Because fever could be a sign of infection. Now, what does chemotherapy do in general? It goes in and it basically attacks the bad cells in your body, right? But unfortunately, it kills good cells too. So the cells that are affected are the white blood cells. Those are the ones that fight off infection, okay? So if that goes down, you're more prone to infection, and that's why I worry about fever, okay? The hemoglobin, or the red blood cells, are the part of the blood that carries oxygen through your body. So if that goes down, you might feel a little extra tired. You're going to be anemic, basically, you know? So you might be tired, you might be a little short of breath. I think the importance with that is really to recognize it and know your limits, okay? Because you're going to be getting your labs checked pretty frequently here with Dr. Trent, okay? So if something is wrong, we'll know about it. But I think it's important for you to know and not get frustrated and say, why am I so tired? Why can't I do this? Why, you know, why do I not have the energy?
I have a 2-year-old. Why can't I chase him?
Exactly. So you know why, okay? And I mean, if it gets to the point that it's really affecting you, and since you're already starting with a borderline hemoglobin, and you're at 10.4, you know, it's something that you really need to be aware of. The only other important thing is I did print out a list of iron-rich foods. So if you want to take a look at that one, you know, whenever you get home. What else? And the third part of the blood that gets affected is the platelets. Okay, and the platelets are the part of the blood that help you to coagulate so that you don't bleed. So if the platelets are low, you're more prone to bleeding. Okay, so just another FYI, something for you to be aware of is notice if you see bruising on your body. Okay, if you brush your teeth and there's a little bit of blood, that's something that you need to let the doctor know about. Okay. Now, so fever, bleeding, and then with one of the drugs that you're getting, the IFOS, the other thing to take note of is, again, bleeding, hemorrhagic cystitis, okay? What that is, it can cause bleeding in your urine, okay? Now, I've talked to Dr. Trent numerous times about this. He says in his whole practice of years and years and years, and you know he's awesome, he's only had one case, and he's not even convinced that it was really a case of hemorrhagic cystitis, and it's because of the regimen, the way that he sets it up, that he sends you home with all this fluid and hydration. He's never seen it before. So I don't think it'll happen, and I doubt that you're going to be the first one that it happens to, but just so you know, if you see some bleeding, it's something you need to, that's an emergency. You need to go to the ER, okay? And then the only other thing would be something like mental status changes, maybe a little bit of confusion, headaches, anything like that. Just let them know. That could be a side effect of the ifosfamide as well.
What about your family's mental status?
That we can't help you with, unfortunately.
If she gets too overboard, can we have her Baker active? Should we have her?
No, you can't. No, you can't. No, you can't.
Girl, I knew something was wrong with you. Get the phone.
Actually, that's one of the most important things, that you have a good family support. So you're one of the lucky ones. So I always say this whole thing is, you know, 90% psychological. So if you got family and you have support and you're ready to do it, then you're gonna do it.
Yeah.
Except for that, a little magazine to read, a calendar, fun stuff like that.
The calendar.
So that you can just do.
Thank you.
Yeah, that's a list of some iron-rich foods. See, that's the kind of stuff that to me is more important. Something that's specific to you. You know?
That's for her. Sure. Let her prepare the meals.
Oh, is she gonna be making the meals for you?
Between her and my grandma,
That's what you're trying to say. You don't like my food? Wow.
Do you have any specific questions or anything that I can help you with?
Oh, I have a question about the hydration. Are you saying that we should continue hydrating her, like after she comes home, just give her a lot of fluids?
I mean, I would, yeah. I mean, you're going to be going home with a huge bag of IV fluids mixed with the mesna and actually some electrolytes, some potassium, magnesium, and things like that. But yes, the one thing that you can do to prevent it is to stay hydrated and to not be dehydrated.
So we can flush it out.
Right, exactly. And I think that's with almost...
So that's important. You got that, baby?
Yeah, with almost any chemotherapy. I mean, I know you're not going to be drinking any alcohol, so that's the number 1 no-no, okay? You'd be surprised. I have to say that. And then...
yeah, you just ruined it.
I have to say that.
She can have some red wine
I'm trying to say it's probably better not
He
to
also
right
said
now.
you would get him in trouble, so don't be saying stuff like
Oh,
that.
you did say that, and I put it on camera now.
The dietitian, they're coming.
They should come by. The dietitian and the social worker should both come by to see you. Okay,
Okay.
so if you have any questions, you can always run stuff by them. Okay?
Alrighty.
And I am here every day. I'm the nurse practitioner here on the unit. So anything that happens to you while you're here, they will call me. Okay.
What's your name?
Adrian.
Adrian.
And my office is right back there in the corner. So
okay.
you know
Why
where to
did you
find
put
me.
your name? Your name?
Oh, because I'm just always everywhere,
card?
so you will see me.
keeps
Yeah, I do
cards.
have
She is
cards.
very
I'll go bring
organized.
you a card if you want. Sure.
Organized like that.
Good. Type A?
Type A.
Not
Not that bad?
Okay,
Not that
no.
bad?
She doesn't have a cabinet
Oh,
labeled
okay.
with what's in them.
You mean you don't have like a pocket Rolodex or something?
What?
Just like 50
maybe.
50 calendar.
Borderline.
And I just got
I'm gonna
another
hold
one.
on to this.
There you go. There you go.
Okay, thank
All right.
you so
No,
much.
of course, of course. And actually, I put in here just since you were asking about the cardiac thing, I put here the ejection fraction and the date. Okay. So just so you always have that.
All right, thank you very much.
You're welcome. I'll be back.
Alrighty.